The notion of care seems simple enough. Care is about nurturing, feeding, nursing, assisting, and loving human beings. It is the work that makes all other work possible. A slogan first used in the early 2000s by the New York City-based advocacy group Domestic Workers United, and later adopted by the National Domestic Workers Alliance. Although it is historically unpaid or underpaid and unaccounted for in gross domestic product, GDP, and other economic measures, without care work, things would simply shut down. Yet while care is essential to our survival, care as a politics, as discourse, as policy, and as labor is complicated, nuanced, and contradictory. Our reliance on care work became abundantly clear when the COVID-19 pandemic hit the U.S. in March 2020. Support systems suddenly disappeared, and families grappled with who would take care of the kids, clean the house, and walk the dog. Over 2 million women left the workforce. Family relationships were strained, and while some children managed, others suffered. Some employers expected domestic workers to live in because they were fearful that otherwise those workers would bring disease into their homes. Parents realized that without child care assistance, it was difficult, if not impossible, to do their jobs. Employers had to acknowledge the critical need for childcare for their employees and for the functioning of their workplaces. The shutdown of schools and daycares and the strain on hospitals and nursing homes made essential labor, which includes care but also extends beyond it, more visible. Teachers did double duty, Zooming with students and minding their own children. As hospitals overflowed, people employed in healthcare worked grueling and dangerous shifts, often forgoing sleep and putting their own well-being and that of their families at risk.